We found out I was pregnant and we were just elated. We just had our standard 20-week anatomy scan.
We were super excited because we had just found out that we were having a boy.
And they pulled us into a room and she said, "There's something wrong with your baby's heart." And I think for us, it went from, your absolute highest high to probably the lowest we've ever been. In a matter of 10 minutes, our world changed. The pediatric cardiologist confirmed hypoplastic left heart, which meant his left side of his heart wasn't fully developed. They went through our options. They gave us all those big, scary statistics.
I didn't know how it would affect him, or even if he would make it through the pregnancy, so.
They said, if you want a second opinion or you just want to explore other options, I can refer you to a colleague of mine at the Colorado Fetal Care Center who's a fetal cardiologist. I emailed Dr. Bettina Cuneo, and in 12 minutes she emailed me back and was so hopeful and so welcoming. So we set up appointments with them, and I think the second we walked in those doors, we knew that this was the place we had to be.
The Colorado Fetal Care Center and the Heart Institute at Children's Hospital Colorado provide the best choice for care for both mother and baby before, during, and after birth. As a national leader in diagnosis, treatment, and successful outcomes, Children's Hospital Colorado leads the way for treating all types of congenital heart defects.
I think one of the most important things that parents need to understand after they've been given the diagnosis of a complex heart defect, you want to make sure you're going to a place that is going to take care of every part of your child's care. And that's what we have at Children's Hospital Colorado is we have one of the best children's hospitals in the country and one of the best cardiac programs in the country.
Your entire Colorado Fetal Care Center experience is designed to deliver better care and outcomes for your baby. From your very first visit, your care team will be here for you and accessible whenever you need them.
When we met Dr. Cuneo, I think the first thing she did was give Becca a big hug. It was really more hopeful talking to her.
These parents come to us with questions, making probably the most important decisions of their life, and they need to have someone they can trust.
We did a fetal echocardiogram, ultrasound, and then we went back and sat with Dr. Cuneo and Dr. Jaggers, who confirmed the diagnosis and just kind of went through the treatment options. I think by the end of that meeting, we knew that that's where we needed to be for him.
Our hospital is built to provide the absolute best care possible for your labor, delivery, and postnatal and neonatal care. And it's all in one place. Your highly specialized care team includes dedicated nurses who are certified in fetal monitoring and is designed to make the experience easier and better for you and your baby. From prenatal evaluation and treatment, to labor and delivery, to the most advanced cardiac intensive care unit in the region, we have the most comprehensive continuum of care all under one roof.
It's really important for parents to understand that if their baby has a complex heart problem, that they should really be looking at a place that their baby can be delivered in so that the baby doesn't have to be transferred to another facility, because we do know that that's very important as far as the outcomes. We really try to have a multidisciplinary approach. You're not just getting a surgeon, you're getting a whole team.
We have the MFM section within the Children's Hospital. So that facilitates bringing together members from different teams who will be in the delivery room working together for the baby.
Father, who used to try and run between and didn't know exactly who he should be with, can just be at one place. That allows more time for bonding, which is so important in those crucial first hours after birth. The mother can go down just one flight of stairs and be with her baby, and then go back upstairs to be cared for herself.
And then they don't have to go anywhere for their surgery. The baby can go down the hall for their surgery in the next few days.
With the only dedicated cardiac intensive care unit in the entire region, the Heart Institute provides state-of-the-art management and monitoring for acutely ill cardiac patients and those recovering from heart surgery. The CICU care team includes a group of highly specialized cardiac physicians, dedicated cardiac intensive care nurses, respiratory therapists, nutritionists, feeding specialists, and more that work closely with the heart surgeon and other caregivers. Parents are always part of the team and participate in the care plan during rounds. They will always have a clear picture of their baby's treatment. It is all part of our family and patient-focused approach to care.
Less than 2 days later, he had his first surgery. The biggest sigh of relief for us was Dr. Jaggers came out and and said everything went as well as it could have. He was only in the CICU for about 5 days.
One of the best assets that we have at Children's is our cardiac intensive care unit. Our CICU is staffed by physicians who have not only undergone a pediatric cardiology fellowship, but also an intensive care fellowship. And that's all they do. And they're very, very good at it.
It very much felt like they were a team working with him. It wasn't just the nurse, it wasn't just Dr. DeCruz. His nurses were absolutely incredible in just making sure we knew what was going on with him and making sure he was comfortable.
What makes our CICU different and better is that actually we try to provide a home for the patient and the family during their journey. We concentrate a very high level of expertise that is available at all times.
They took care of him, but they also made sure that we as parents were included and felt like we were a part of that care team and it wasn't just us watching them take care of him.
Yeah, when they do rounds every morning, they include the parents and ask us if we have any questions or ask questions of us. And it really makes you feel good to be included.
Our nationally renowned pediatric and adult cardiologists provide lifelong care for babies with congenital heart defects in our complex congenital heart disease and development clinic. From the very beginning, through the child's development into their teen years, when patients enter adulthood, they continue their care in our adult congenital heart disease program.
Oliver's had 2 surgeries now. He'll have 1 more surgery.
The transitions have been seamless. His Heart Institute team was behind the scenes making sure that he was going to get the best care he needed to.
We used to tell parents that their child was cured after their heart surgery, but we know that they can have uncommon complications later on in life. And so we think it's our job to take care of the child from the time the diagnosis is made for their entire lifespan. So at the Heart Institute at Children's Hospital Colorado, we've developed teams that would manage the fetus, the child, and the adult throughout their lifespan.
The Colorado Fetal Care Center and the Heart Institute are national leaders in congenital heart defect diagnosis, treatment, and outcomes. Physicians all over the country refer their patients with the most complex cardiac diagnoses to us. This means our team manages and treats higher volumes of these complex and rare conditions.
The benefit of seeing so many patients is that the rare becomes common to us. The more we see, the more we do, and the more we do, the better we become.
We want families to know our outcomes and to be able to ask any question about our experience with the particular problem that their child may have.
The ultimate objective we have is to have 0% of mortality and morbidity. Until we get to that point, we won't stop working hard to become better.
We can't do that without good research.
Children's Colorado gave us life. They gave us the ultimate gift in making sure that our baby would be the normal, happy toddler and do all the normal kid stuff in a time that we thought maybe he wouldn't.
Some of the doctors said he would be low energy, and I have yet to see that. If you saw him outside of the hospital, you would have no idea that he has any kind of congenital heart defect.
Without Children's Colorado and Dr. Cuneo and Dr. Jaggers and his entire team, I don't think he would be here and thriving.
If you or your family are facing a congenital heart defect diagnosis, or if you would like a second opinion about your diagnosis, the Colorado Fetal Care Center and the Heart Institute are here for you. Please contact us to discuss our processes and procedures, outcomes, and research and innovations, as you determine what's best for you and your child.